I'm very much surprised. Today I am here with a special topics.
So in this topic we have clearly asked you to be prepared, be patient, have a cool mind and come with me. I am repeating, come with me so that at the end of the session you all shall be able to explain the metabolic pathway. Explain the metabolic pathway of cholecalciferol synthesis, my dear friend. Also we are going to learn the least. What, my dear friend? The least of dietary resources and the RDA. Also we are going to explain the role of calciferol on the intestine and the bone and the kidney. Lastly, the correlate with the disorders and explain the hypervitaminosis. What are the side effects of these vitamins? So dear friend, some studies that suggest globally many suffer from the vitamin D deficiency. So we have raised the curtain that we are going to learn, we are going to have a study on vitamin D deficiency. So according to the study, so many suggestions. So first of all, that all studies in virtually all nations, irrespective of latitude, so that the majority of the world's population has an adequate of vitamin D status, my dear friend. Remember, inadequate vitamin D status, some studies, almost all studies convey. Most people are not exposing themselves to the sun during the right hour. Yes, many more friends who are asking what is the right time. I am working here since last whole days, since last whole year, since the whole 10 years in sun, but I am not having this adequate quantity of this vitamin D level in the body. But why? So my dear friend, the sun during the right hour, what is the right hour? 11 a.m. to 2 p.m. my dear friend, and this has resulted in a major vitamin D epidemic and various health consequences related to it. So while you are going to improve your vitamin D level, you have to sit in front of the sun or in the sunlight 11 a.m. to at least 2 p.m. when regularly, not in a one time and two time. How? Because the sun is the key source of vitamin D, my dear friend. There are a lot of the secondary source, but this is the key source of vitamin D, my dear friend. So what are the ways and how we are going to obtain the vitamin D level in the body? That I am going to discuss here. So there are the 3 ways to obtain the vitamin D level in the body. How? So first, my dear friend, I am going to say sun exposure. How sun exposure? That is a question. How many time? How many hour we have to sit in sunlight or in sun? So there is some studies suggest that 10 to 15 minutes, my dear friend, 10 to 15 minutes per day with 40% of skin exposure without sunscreen. 2 most important thing, 10 to 15 minutes, 40% of the skin exposed, not only the face, not only the palm, not only the feet, the 40% of skin exposed without any sunscreen, because sunscreen repels the sunlight, especially UVB and there are also UVA, UVB. There is a different thing that I will study after some part. Consuming vitamin D rich food such as oily fish, example salmon and mackerels, and there are a lot of things that through that we are going to consume vitamin D rich food. That the way we are going to improve the vitamin D deficiency level. The third, vitamin D supplement. So there are there are vitamin D rich food and there are vitamin D supplement. So these 3 are most important way by which we are going to improve our vitamin D level. So dear friend, there is a question that how vitamin D metabolizes in the body. How? So there is a question mark. How our skin is useful to improve the vitamin D level in the body with the help of sunlight. So first, before going to study this metabolism, first we are going to study that what is a vitamin D. So vitamin D is a fat soluble vitamin. It resembles steroid in structure and functions like a hormones. Yes, it is called a vitamin, but just it is a hormones. How hormones? Just we are going to learn. So during the cholesterol synthesis, my dear friend, remember, during the cholesterol synthesis, the 7-dehydrocholesterol is formed as a intermediate. Means what? Means when the exposure of sunlight falls on the skin, these 7-dehydrocholesterol converted into cholecalciferol, that is a vitamin D3. So remember my dear friend, in the sun, when sunlight throw on the skin, there is a 7-dehydrocholecalciferol that is converted into cholecalciferol, that is vitamin D3. This UV radiation. What UV radiation? Because when the sunlight throw the ray, there are some UV radiation, my dear friend, and that is the most important that I am going to zoom here. You can understand the things. There are UVC, UVB, UVA and ultraviolet. UVC, UVB, UVA and the ultraviolet. See, in the sunlight there are so many things, but conditionally it is approved that if UV lamp ray falls on the screen, then there is a conversion happens. If this ultraviolet A, ultraviolet C, ultraviolet E will fall, or this what is called the I'm just forgetting the things of name, but you can understand that this is the visible light, that is a we are seeing there's a visuals, there are so many colors are there, but the colors that is a visible. So in this visible light, this vitamin D is not going to convert. In this UVA, this vitamin D3 is not going to convert, but there at the stage of level, we are going to talk the recommended dietary allowance. How this dietary allowance is recommended and approved and suggested. There are three things: recommended, approved and suggested. So in children, or the children, deficient children, or the children which is required the amount, which is a 400 IU per day, adult 200 IU per day, pregnancy and lactation, there is a 400 international unit per day is required, and the person who is having more than 60 years, that is 6000 international unit per day is required. When you are going to the food related resources, there are fatty fish liver oil, egg yolk, these are the important recommendation. What happens if the deficiency occurs? So there is a ricket in the children, already you are knowing. For adult it is a osteomalacia, that is a very destructive disease for a adult. So what are the cause of vitamin D deficiency, my dear friend? What are the cause? So already we have talked this. When we are going to talk this cause, it means we are going to revise the things what we have learned, because whatever the things we have learned, on that basis we are going to have some crux knowledge. What? If not exposed to the sunlight, because you have already learned how this sunlight is used for the conversion. After conversion it goes to the liver, after conversion it goes to the kidney, and at the last of absorption happened and remove of the body. So no exposing of sunlight means no vitamin D3 absorption, conversion. Bedridden for long time. If the patient is having bedridden, so he is not prone to go outside and the sunlight will not come. People who cover the whole body and not exposing the light, nutrition deficiency is not taking, he and she not taking the deficiency nutritional food, malabsorption of vitamin D is some due to the high fights and the same constipation high level, or this indigestion happens, so there is a malabsorption of vitamin D. Abnormal activity of vitamin D, liver and renal disease may decrease the hydroxylation. If there is a problem in the liver, so they are not going to absorb this vitamin D level in the body. So my dear friend, these are the features of rickets. You can understand this is different, this bending and like this, that is a knock, it is a bow legs, Harrison, sulcus. You can see this, you can find out it is a minimum we have seen in India, but mostly it have seen with outside India like this. Somehow we have seen, we are lot of the patient we have seen like this. So the clinical feature of the rickets. What are the clinical features? So insufficient mineralization of the bone becomes soft, pliable, and growth is affected. Serum calcium and phosphorus are very low, and the increase of ALP characteristic feature of the ricket. So osteomalacia, what is osteomalacia? There was a terminology that already we have talked about. Now there is a scientifically we are going to understand. Osteon, there is a terminology means bone. Malacia, there is a terminology means softness. If bone is going to be softness, that is called osteomalacia, means osteomalacia. The bones are softened due to the insufficient mineralization and increased osteoporosis and prone to the fracture. So biochemical parameter, the low calcium level, phosphorus level, and obviously the giant vitamin D3 level. This is the giant vitamin D3 level. That increases the alkaline phosphate. That is the laboratory assessment. What are the laboratory assessment? So nothing to go very worried, because already we have late and we have to take the dinner also. So this is the time that we are not going to have more time. So the half-life of circulation will 2 to 3 weeks. That is the most important thing that I am going to convey the point. The different type of rickets, this classical of vitamin D deficiency, the hyperphosphatemia rickets, vitamin D resistant rickets, renal rickets, renal failure, decrease. That is the thing. Yes, I can understand. Now we are going to have the dinner. So hypervitaminosis, just 5 minutes I'll take. The hypervitaminosis means the dose if above the 1500 international units per day for a long period, that called the toxicity. What are the toxicity? Like the nausea, loss of appetite, increased stress, and the loss of the beta. Definitely, my dear friend. Hyperkalemia result to deposition of calcium in the soft tissue and kidney result to calculi. There is a calculi formation in kidney. So although vitamin D is toxic in higher doses, that excess exposure of sunlight don't result in vitamin D toxicity. Means this happening only with taking the outer side supplements or food. It is not happen with the sunlight, because how the excess D3 is destroyed by the sunlight itself. That is a major part, my dear friend. You see, this is the point that is a most relevant and unique point. So how calcitrol is a hormone? How we can say? So synthesized in skin by UV ray, action on the larger tissue like bone, intestine and the kidney, action similar to the steroid synthesis, and half-life is very low. So why does vitamin D affect so many biological processes? You can see in this picture. You can see in this picture, my dear friend. You can take the snaps so that while you are practicing or while you are this in your spare time, tea, coffee, anywhere you can take the snap and use this information. Hypertension, my dear friend, this is the topic that is the most important topic, and that has a correlation of vitamin D, because millions of people are suffering from the hypertension, in the world. So low 125 dihydroxy vitamin D level that activate the renin angiotensin aldosterone system, that is a RAS system. Why here is the RAS system? Actually, it has not given here, but you can see here how this renin converted into this, and this conversion happened. Now I'm going to zoom here so that you can. So my dear friend, so we have understood the concept. So UV and EM are divided into three components according to their wavelength. How this UV is converted into UVA, UVBC, UVBB and the other thing. So UVA means there are 320 to 400 nanometer. There is a intensity. UVB means 290 say 320 nanometer. And the most importantly, my dear friend, there are UVB. But when UVC, there is a one terminology that I am going to show, that is a UVC, that is 100 to 290 nanometer. So this is the, so how this UVB is important. Just we have learned, my dear friend, the absorption, the conversion mainly happened with the UVB. How? Just I am going to convey, my dear friend. This absorbed by epidermal layer. This UVB is absorbed by which? Epidermal layer, where the highest concentration of 7-dehydrocholesterol exists. So in epidermis layer, there are 7-dehydrocholesterol exists where this absorption happened. Sorry. Mainly the optimized wavelength range is 295 to 300 nanometer, which is a UV occurs. So UVB exposure doesn't require is excessive production of vitamin D, risking intoxication because pre-vitamin D3 is converted in inactive product lomestrol. So that is the things. Now my dear friend, you can understand. So what happened if a person is having dark skin? What happened? So now understand. Dark skin people have more melanin. What is, my dear friend? More melanin. Here you can see what I have written here, melanin. So dark skin people has more melanin in epidermis, which compares with the 7-dehydrocholesterol for absorption of UVB photons. Understood, my dear friend? ज्यादा मेलानिन होने के कारण कहाँ एपिडर्मिस में which competes with 7-dehydrocholesterol for the absorption of ultraviolet photos. So my dear friend, you can understand the things. So what happened? So dark skin people are less efficient in the producing vitamin D than the white. So the dark skin people used to have the food either or the supplements. Understood, my dear friend? So it has been reported that dark skin people require 10 to 15 times more exposure to the sunlight while to produce the same amount of vitamin D as a person with the white skin. So there is very complex communication and relationship between vitamin D and the dark skin. Yes, my dear friend, you have seen or you are going to prescribe to vitamin D supplement. So most of the obesity patient, how? So here the topics is obesity leads to less vitamin D. How obesity destruct the absorption of vitamin D. This obesity people have more 25 hydroxy vitamin D level. How? 70 hydrocholesterol in the skin of obese and non-obese individuals are the same. So my dear friend, in obese, the subcutaneous fat stores the vitamin D and the result is less release into the circulation. Understood here? Accumulation of vitamin D3 happens in the subcutaneous tube because of the fat that is stored the vitamin D but is not moving to the circulation. So that is the main thing. So any obese patient, he and she has to take the vitamin D3. Any dark color skin patient, he has to take the vitamin D3 or vitamin D supplement or vitamin D food. What are the role of sunscreen, my dear friend? These efficiently absorb UVB radiation, my dear friend. These efficiently absorb UVB radiation. Yes, the person who are suffering for any skin disease, they used to or either prone to use the UVB while working on the skin, sunlight. But they are having some deficiency of vitamin D. Why? These efficient absorb UVB radiation के absorb करने के कारण dramatically prevent the interaction of UVB with the 70 hydrocholesterol. They prevent, and due to this prevention there is less conversion, and that the process of pre-vitamin D3 generation. Understood, my dear friend? So avoid the sunscreen if you are not having any issue. It is also shown that SPE of 8 reduces the production of pre-vitamins D3 by 95% and the 99 by SPE 15. Those patients taking the sunscreen or utilizing the sunscreen, they can understand deeply how and he is not able to utilize. My dear friend, ultimately we came here on vitamin D metabolism, how this vitamin D metabolism occurs. So in this chart you are going to see how that cholecalciferol is the first hydroxylate to 25 hydroxy cholecalciferol in the liver, a major estrogen. Previously we have seen the conversion, sunlight touches the screen, there are some conversion happened, and that cholecalciferol now converted into 25 hydrocholecalciferol in the liver, that is a major storage form. In the plasma there are 25 HCC is bound to vitamin D binding protein on alpha 2 globulin. This is a vitamin D binding protein and alpha 2 globulin. So understand, my dear friend, there are the process and all the process written here, all the process. Again, my dear friend, again I am going to convey. So it is converted to 125 dihydroxy cholecalciferol by the enzyme, what? 1-hydroxylase. So this is called the calcitriol because it has 3 OH group in the kidney. The first, there are 3 axon, 1 axon on skin, second axon on liver, and third axon on kidney. Understood, my dear friend? Now there is a topic comes, that is a biochemical effect of vitamin D3. What are the biochemical? So calcitriol act, here you can see here, calcitriol act on 3 different targeted issue: intestine, bone and kidney. Intestine, bone and kidney. Here this is the chart where all things here written, so you can understand the biochemical effect of vitamin D. Calcitriol action of intestine. First now going to talk. So calcitriol will increase the intestinal absorption of calcium and phosphate. How? This calcitriol increase the intestinal absorption and phosphate. It is the intestinal cell calcitriol bound with the cytosolic receptor, my dear friend. That is a form of calcitriol receptor complex. I am sure that you all are understanding this point that I am going very easy way. This is the easy way that I have captured, and now I am going to communicate. So the complex that approaches the nucleus